from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Hey, welcome back, everybody. You know, February is Heart Awareness Month. We've been talking about it all month long. Now, if you or someone you know has been diagnosed with heart failure, you need to pay attention here because there are many things that can be done to give you a quality life. That's right. It is important, though, to follow these steps. So joining us this morning to explain and promote a great opportunity for you to ask your heart doctors questions later on tonight is a heart failure specialist, Dr. Patrick Campbell with Baptist Health Heart Institute. Dr. Campbell, thanks for joining us, and we appreciate you taking some time out because I know you guys are going to be here with us a little bit later tonight. We'll explain that call-in just a moment, but let's talk about heart failure in general. What does it mean to have heart failure? What are the different signs and symptoms, and what are some of the things that causes it?
So really, heart failure kind of comes in two flavors, if you want to think of it that way. Okay. There's diastolic heart failure, where you have a stiff heart. The heart doesn't relax properly. And then you have systolic heart failure, where the heart is weak and it doesn't pump enough blood. Really, it doesn't matter which one you have, the symptoms are essentially the same. People are short of breath, they're fatigued, they don't have a good appetite, they swell, they fill up with fluid in their legs and their abdomen. Exercise becomes almost impossible. Even daily tasks can sometimes become very difficult. People have difficulty sleeping at night and have to prop themselves up so that they don't basically drown in the fluid.
Okay, so how common is this? I know in Arkansas, among women, heart disease is the number one killer, but how common is it?
Well, heart disease unfortunately remains one of the number one killers in the country. Yeah. There's about 6 million Americans with heart failure and about 550,000 new cases every year. So it's pretty common. And unfortunately it's growing in part due to the fact that we've improved the way that we treat other cardiovascular diseases. So, 30, 40 years ago, people who would have died from a heart attack are now living and surviving, but that ultimately can lead to heart failure. So
what are some of those treatment options that have advanced through technology that have helped people live those quality lives?
So when you talk about cardiovascular disease in general, the things that really have improved the longevity has been changes in medications, changes in stents for the heart, that stents that last longer, they stay open longer. Bypass surgeries have improved over time as well. And then things like defibrillators that keep people alive if they have a fatal rhythm, and so it'll shock their heart back to a normal rhythm and keep them alive.
Well, lifestyle changes, as well as some of those treatment options that you mentioned, how much does that factor into someone's long-term sustainable health?
I think I tell my patients all the time that medication does 50% of the work, and then the 50% of the work is their lifestyle changes. Things like eating a low-sodium diet, monitoring their blood pressure, keeping it under control, restricting the amount of fluid they take in if they do have heart failure, quitting smoking, exercising. Recommend everybody get 30 minutes of cardiovascular exercise every day, and then eating a healthy diet and low-fat proteins and fresh fruits and vegetables, avoiding processed foods. And so those are the things that we really recommend that patients do outside of their medications to really improve their cardiovascular health in general.
Now, working in Baptist Health for the last 5 years, what do you think separates Baptist Health as one of the leaders in heart health and helping people get this quality of life back here in the state of Arkansas?
Well, I think I've been really lucky to work here at Baptist, and we offer comprehensive heart failure care that nobody else offers in this state, whether it be from initial diagnosis and treatment of their heart failure and cardiovascular rehab and nutritional guidance, all the way up through advanced heart failure therapies. And what we offer is cardiac transplant and the LVAD, which is an artificial heart pump. Oh, wow. And those are two treatments, the only two treatments for end-stage or terminal heart failure that are available.
All right. Well, thank you for joining us this morning. I want to remind everybody tonight, 5 to 6 p.m., if you call this number, 324-7888, you can talk to heart doctors from Baptist Health. They're going to be answering your heart health questions throughout the evening. That's starting from our 5 o'clock newscast going all the way through our 6 p.m. newscast to the end of that. So please call in if you have any of those questions, and don't wait. If you think you are experiencing these symptoms, talk to a doctor tonight to see if you need to be treated. Thanks, Doc. We'll see you next time.
Thank you very much.